since COVID-19 pandemic, there has been a lot of emerging data regarding interrelation between COVID-19 and diabetes. Now, three facts are absolutely clear. Number one, diabetes itself increases somebody's risk of having COVID-19 infection. Number two, if you've got poorly controlled diabetes in terms of higher HbA1c, then your chances of having severe infection with COVID-19 are much higher, and your likelihood of ending up on ventilator is again higher compared to somebody who has got better control of diabetes. Number three, about 20 to 30% of COVID-19 cases who died have had diabetes. So all these facts actually tell us that diabetes undoubtedly is number one risk factor for COVID-19 infection. But look at this statement. Well, hang on a second. We are claiming here that COVID-19 can actually cause diabetes in someone who was non-diabetic before getting COVID-19 infection. How is that possible? That sounds quite alarming, doesn't it? Let's get to the bottom of the mechanisms at cellular level. Now, without too much of medical jargon, I'm going to try and explain to you what is happening here. So our human body cells have got something called as ACE receptor, or imagine this as a protein which acts as a gateway or an entry point of door to many viruses. So if suppose a person gets COVID-19 infection, this virus actually can attach itself onto this protein which is there on most of the human organ tissue cells. Now this acts as a gateway for this virus, which actually allows the virus to go into the cells. So imagine this happening in lungs, causing destruction and all the complications related to pneumonia. But imagine this happening in pancreas or beta cells, which produce insulin. So this actually can cause destruction of beta cells, lack of insulin, and then again worsening of existing diabetes control or inducing new onset diabetes. But this leaves us with some unanswered questions. What type of diabetes is it? Is it type 1, type 2, or some new form of COVID-induced diabetes? Now, what if a person gets COVID diabetes? Is he going to ever recover from that diabetes, or is that going to be a permanent thing? We unfortunately don't know the answers to that, but the research is ongoing as we speak. But till then, we need to make sure that we screen ourselves for diabetes at least every year, and somebody who has got diabetes already, make sure that you actually see your doctor regularly, monitor your sugars, and have some regular follow-up. Let's do our duty.